I saw a balance in nature.
2 million Americans will be diagnosed with cancer this year, more than 2 million. That'll be a record high, but the number of overall cancer deaths is dropping. Fewer smokers, early detection, improved treatment, all contributing to that. So the U.S. is getting better at treating cancer, but we're falling behind on preventing it. Let's bring in Dr. Mark Siegel for more on this, and nice to see you. I'll throw some numbers your way here. 2 million new cancer cases, as we mentioned, about 600,000 cancer deaths. Among the estimated new cases for men, about 30% prostate, 11% lung, 8% colon and rectum. For women, breast 32%, 12% lung, and 7% colon and rectum. Does that match up with what?
Correct. And here's the headline. The headline is lung cancer, we're doing a great job. We have saved, by the way, 4 million people over the last, since about 1990, with all of these interventions, early screening and stopping smoking being key. Not only have we prevented lung cancer a lot of the time, but when we find it, we're finding it earlier now. We're taking it out with a robot before it spreads. Huge improvement in 5-year survivals of lung cancer. But the flip side of that, you were already alluding to, which is colon cancer, especially in young people, is on the way up. Prostate cancer, uterine cancer. Why is this? Obesity. I think simply we're gaining weight as a society. We're more sedentary. Our diets aren't as good. There's more preservatives in our food. All of that. So we're smoking less, but we have a problem with lack of exercise and obesity. All leads to inflammation, which leads to cancer. Another point is that our insurance system is focused on disease, not on prevention. In other words, the more people that are sick, the more people that they have that they can then give an intervention to, and premiums go up. We're a disease-oriented system rather than a health-oriented
system. So the number's not getting higher because among younger Americans, because the detection is not higher? I can, let me try and rephrase that.
Okay, let me fix that.
But you're saying it's obesity, right, for younger Americans. And I'm asking if younger Americans are being tested more often, are doctors just finding it at an earlier age?
They're not being tested more often. We have a number. We use 50 years old to start our colonoscopy. We use 40 years old to start our mammograms. We're starting to move in that direction. HPV-oriented cancers, human papillomavirus, sexually transmitted. We have to be on the lookout for that. Younger people don't want to be screened. They want to be out there and have fun and live their lives. We have to reorient our screening system towards more young people.
The other thing that's happening and related is this widening gap between life expectancy and the number of years you would spend in good health. So we might be living longer. We can pull up some of these charts here. You're living longer, but you might be living with more disease, and your health isn't as good.
This is shocking, Dana, and this comes out of the University of Washington, where I like to say maybe they can go mountain climbing there. I mean, that's such an outdoors-oriented place, Washington State. But listen to these numbers. Back in 2000, 20% of adults were living with multiple medical problems. Now it's 30%.
Wow.
So the average health span, we call it health span, how many years you got before you start having chronic illness that starts to affect your whole quality of life. It's 65 years old now. It was 65 years old in 2000, in 1990. But we're living to 77, but we're limping along with more medical problems. We got more technology. I have more ability to treat you, but frankly, I'd rather that you have the health span. People say, I want to be alive as long as possible, but if you're not enjoying your life, we have to focus more on that.
Wow. Do you study that health span?
Absolutely. That's what we're interested in the most. Because my patients come into me and they say, Doc, I'm not enjoying my life. You know, let's take diabetes, for example. Diabetes, if it's under control, you can have a high quality of life, but if it's not, your nerves can be bothering you, you're not seeing as well, your kidneys can be a problem, you end up on dialysis potentially. So we have to get our health in order to enjoy our lives.
That's all about quality of life you're talking about.
You bet it is. Yeah. And we talk about it all the time. It's
fascinating.
It's really, and again, number one is exercise. You have to get up and exercise. Even if you're just walking, people don't realize walking is a great exercise. You know, you have something on your Apple Watch or something that tells you that you walk 5 or 10 miles a day. Yeah. If you don't have, chronic orthopedic problems, huge advantage even to walk.
That's why it's good to get a dog.
Oh my God.
And have to walk the dog.
Yes. The dog is